We'll get started in a couple of minutes. We'll give people time to log in. It's a beautiful day today, isn't it? I think we had a community forum about 3 to 4 weeks ago, and it was just to talk about, or identify some additional needs for, Imperial County. And that was great. We had quite a few of attendees, and we wrote really good notes. And what we're trying to do is secure additional resources to meet some of those needs. And after that, we said, no, we need to continue with these. And so, yes, every other week we'll have them in English at 11 and then in Spanish at 1 p.m. And I'll be doing both. And then the plan is based on the type of questions. If there's questions, for example, the hospitals or any other provider, then we'll have guests. We'll invite our partners from these other areas to hopefully answer some of your questions. So yes.
Great, thank you.
All right, so it's now 11:04, and we will get started. And thank you, everyone. Thank you so much for making time to check in with us and just find out what's going on. And we too want to listen, from you all. What are you seeing in the community? What are some of the needs that you feel have been unmet? And that way, if it's for public health, we gear up and start looking for, those resources to bring down to our community or work with our partners. Because, sometimes we are so focused that, we don't see everything that's going on. So again, it's really, really helpful to have you all here. And with that, I'm going to start sharing my screen. Just give Andrea Bowers works with the Public Health Department, and Maria Peinado. So I don't know which one will give me sharing capabilities so I can, put up the PowerPoint.
I got you set up.
Wonderful. So give me just a second, and I will start sharing. Oh, I started sharing the Spanish one, sorry. There we go. All right, so today, just a few things we have going on. Quick introduction, then I'll move into, Imperial County and what has happened in the last 10 to 11 months, and it'll be really quick, an overview and what the department's response has been. I will then talk about our current situation, some next steps, and then we get to talk about, things that, you may have questions on, or just comments and suggestions that you may have. Before we do that, though, you always, want to know a little bit about, the whoever's speaking. Today, Jeanette Angulo, the Imperial County Public Health Director, will be talking to you. And instead of just running down, my bio, I have a couple questions for you. Do you happen to know how many years the Public Health Director, Jeanette Angulo, has worked in this department? You can shout it out. You can put it in the comment boxes. Anyone?
Maybe 8, I don't know, 7?
No.
15.
Cold. Warm.
18.
10.
17.
Oh, wow.
So Jeanette Angulo has been with the Public Health Department 17 years. What was her first position at the health department? Anyone want to guess? No? No clue? Jeanette Angulo started as an administrative analyst. So I did some analyst work with the immunization program. I then got the opportunity to be the immunization program supervisor. I did that for about 2 years, and then I got the opportunity to be the health promotion manager. And then I did a lot of work with nutrition, tobacco, immunizations, HIV/AIDS. So I did that for about 7 years. And then I got the opportunity to be a deputy director. So I was the community health deputy director. So not only was then I doing health promotion, I was also doing maternal, child, and adolescent health and emergency management services. And then earlier this year, I'm a pandemic director. I got hired as, the public health director in January. So that's been, that's what I've been doing at the public health department for the last 17 years.
Wow.
The last question. How many pandemics has Jeanette Angulo responded to while at the health department? You want to guess? No? Two pandemics, H1N1 and, well, this one, COVID-19. During H1N1, I took more of a lead role when it came to logistics and operations and clinics, those mass clinics that you may remember at the Imperial Valley Mall, where we immunized over, I want to say it was over 5,000 residents. And then, we did some work at schools, public and private schools, with some faith communities, community leaders. It was a great response back then. So, and then, well, this one where January, that's when I got hired and tough decisions needed to be made. But I have an excellent team at the public health department, and we've been able to provide the needed services, to the best of our ability to our community. So later on in future forums, I'll have a few trivia questions to see, if you know a little bit more about, your director. So I'm going to move on to the last 10 to 11 months. What has been happening in, Imperial County? Specifically, the public health department was monitoring the situation, and it goes back to H1N1. And in Imperial County, we identified, it was almost at the same time, Imperial, San Diego, where we identified through our surveillance program our first H1N1 case. So we knew that we needed to be vigilant, we needed to be on the lookout, and therefore, December 2019, that's when our management team, our epidemiology team, started monitoring the situation. February 2020, the department activated its operations center. So it's like an emergency team that, comes together, and it's a center, and we have like an incident command structure, all that emergency kind of stuff. Well, we activated our center back in February 2020, even before we had a case in Imperial County. The health officer, Dr. Monday, who I work, very closely with, and the county both decided to do a declaration and a proclamation of a local health emergency. And the reason that was, it just makes it so much easier to request and pull down services to our community when you have that kind of declaration or proclamation. March 8th, we get our first positive case. March 19th, the state and county issue a stay-at-home order. Let me tell you something interesting that happened. Imperial County already had an order drafted, and we issued it on Wednesday, and I believe by Friday it was going to become effective. But then at the same time, the state worked on an order, so they went out, at the same time. So, March, that's when we had the stay-at-home order. March 31st, unfortunately, we reported our first death. Early May, we had a sharp increase in COVID-19 cases. May through July, over 600 COVID-19 positive patients were transferred to other California hospitals. Many were transferred to Southern California hospitals, but we had patients transferred all the way up to, the Bay Area, the Sacramento area. So very significant there. At that same time, it's not there, but we also set up an alternate care site And at that time, I believe it was May, when we set it up at the Imperial Valley College, we started transferring patients, those that didn't need as much care, but still needed care, went to the college, to that alternate care site. And then, the state and the federal government had doctors, therapists, all those professionals that are needed to take care of patients. They were there to tend, to the patients. We closed that in August, and we did see a total of 213 patients at that site, the alternate care site. By that time, the state and federal government, they inundated Imperial County with resources, which we are truly, truly grateful for. And that was resources for the hospitals, resources for the skilled nursing facilities, for public health, and for many other agencies, directly and indirectly. Now, COVID cases, to give you just a better idea, quick snapshot, by the end of March, we had a little over 40 cases. End of April, we had 400 cases. And for a county our size, that is a lot. And let me tell you, our epidemiology team, 4 people, pretty much. That's what we had for a county our size. That's what we were able to fund. 4 people, 400 cases, that was way too much. But look at this. End of May, June, July, our cases increased to over 3,100 cases. End of May, 7,600 cases. End of June, over 10,300 cases. End of July. Those were tough times, and tough times for quite a bit of agencies in our community, because that's when the sharp increase happened. End of August, we started to see, a decline, which, we were so happy to see. If you notice, we only had a little over 12,000 cases end of September, still significant for a county, but not as, huge as May, June, July. Now, end of October, we did see over 1,300 cases. And that's when we started noticing again, an increase in activity in our community. And to better, see it, I'm a visual person. I really like images because it gives me, a better sense of what people are talking about. So that image is from the state of California, the COVID-19 page. You'll find this and many other great resources. These are cases, COVID-19 cases, and the blue line is Imperial County, and the gray line is the statewide average. So that's our May, June, July, period, what I've circled there. That's the start of May, and that's our peak. So sometime in July, we started to see a decrease, like I said, in August. But then in October, we're now in November. If you notice, October 1st, that's when we started to see an increase. It's not as sharp as May, June, July, but it's still an increase. And that is concerning because we're not the only ones seeing an increase. It's nationwide. Many other states are having the increases that we had earlier in the year. Again, for us, it's not as sharp, but it's still concerning. And below, and we'll make this presentation available on our website, just in case you want to go in and explore these, this information later. I highly encourage you to do so because there's wonderful, information in the state's website, in our website. We have a dashboard, you'll find it. Resources for Imperial. There's requests that are done through the Public Health Department because we have a program. We have the MOOC program, and I don't remember what it stands for. It's the Medical Health Operational Coordinator, I believe. I'm missing a letter, but that coordinator is like the liaison. And so we work with the local agencies, and then we work with the state and federal government, and we find the resources. We try to find the resources that are being requested locally. So in Imperial County, over 83 agencies requested resources. We've been, so a total of 240 requests because agencies can submit multiple requests. We've been able to do over 385 deliveries of such resources. And as you can see on the right side, Those items that have been more popular include surgical masks and 95 respirators and gloves. So we've distributed over 1 million items. And like I said, all these resources come from the state, resources and that they have. Now, the public health department through the MOAC is also responsible for securing, the needed personal protective equipment, like I just said, but also personnel support for the hospitals. We had personnel support for the skilled nursing facilities, for the public health department. So we had, staffing from different groups help with the situation. And we still have staff, not as many as we had May, June, July, but we still have help from the state and the federal government. As you can see, some of them include the National Guard, the disaster medical assistant teams, California Health Corps. But not only that, it's not only staffing, it's not doctors only, nurses, therapists, etc. It's also medical equipment. So those shelters, those tents that you see at the hospitals, that you saw maybe at IVC, those are also secured, through the state and federal resources. And then, but because of, our weather, etc., we may need air conditioning equipment, generators, and anything and everything else that we need to support these temporary tents. Additional support. There's a picture of the inside of Imperial Valley College. That's what it looked like, back in May. And again, 213 individuals served, and it's ready right now. It's patient ready in case we were to need that again. As of right now, it has not been utilized, but if there's a need, we will utilize it. COVID-19 testing, that's another resource. Many of you might have taken advantage of that. We at one point had community testing at no cost made available by the state in Brawley, Imperial, and Calexico. Currently, we have testing in Brawley, but we are looking at securing additional testing, and this would be like more travel teams, so they would go from place to place, maybe a mobile unit, maybe doing a lot more targeted testing. So for example, now that we have the harvesting season, partnering up with groups so that we can do testing for the agricultural community, the schools, some of those other groups that may need testing assistance or access to testing. So we're trying to expand that in our community. And then one last comment about, additional support. There was a time where we had this big mobile unit in front of our public health department. It was the California National Guard Laboratory. So they helped us process a lot of the specimens that we were getting from our community. About 3 weeks. That's the amount of time they helped. And then we do everything else at the public health department. So we have epidemiology, we have a laboratory, we have people assigned to help with skilled nursing facilities, jails, other congregate living facilities. We have a call center, which we fielded over 5,000 calls. We have a crisis communication team and our public information officers who do communication and awareness. We have data management, that dashboard that you guys see on our website. Let me tell you, we've done miracles with that dashboard, and we actually, those individuals that have helped in that capacity, that's not what they were originally here for. They just happen to have the skills, really great skills, and so they were able to put those, that system together, that dashboard together, and they've been great. Everyone who has responded to this, COVID-19 pandemic has been great. But anyways, we do that, and then we do the COVID-19 vaccine planning, and then we search and secure funding, for resources that may not be here and that we may need. So other public health efforts, and I'm sure all other agencies are doing the same, wearing 6, 7, 8 hats, trying to meet the needs of this community. For sure, the hospitals, the first responders, the food service providers, food bank, and everybody else. Like I said, it's been a true team effort. That's the dashboard that I've been talking to you all about. And on the top, I have the website the direct link to the dashboard, and then the public health department, you know, the website, and it'll take you there. We've done over 83,000 tests. That is not individuals tested, it's tests. Many people have had multiple tests over time. If you notice, the next box here has the total positive cases. And you know, early on the community was saying, well, how do we know some of these are not from Mexicali? How do we know some of these are not from another county? Well, we were listening, and we, you know, to the best of our ability, given our investigation, we have been able to separate some, you know, of that information. And, you know, you see out of county cases reflected on the top, 300. So those individuals live within the United States, but not in Imperial County. We have 153 cases that are out of country. Those have been identified as living in Mexicali for the most part, or another country. And then we have our total positive cases, over 13,800 cases for Imperial County residents. Now, we have you know, a total of 12,899 cases recovered and 599 active cases. Like I said, we've seen an increase in cases in the last few weeks. So I know our community got really excited when that number was just diminishing, and we were too. Let me tell you, unfortunately, we've lost over 340 residents. On the other side, you'll see the zip codes. Calexico, being the border city, has the highest number of cases, followed by El Centro, Brawley, and Imperial. But if you notice, those are the most populated cities in our community. So it may make sense that more of the cases are concentrated there. Age groups, let me tell you, I've heard comments made that, you know, this virus is only affecting the older people. No, it is affecting everyone from, you know, 0 to our senior citizens. And if you notice, we've recorded cases in the 0 to 9. We've recorded cases in infants. And, you know, over 90 persons 90 years old or older. But the most cases are found within, you know, the 20 to 39 age groups, and then the 40 to 59 age groups. And in a way that makes sense, because these individuals are out and about. They're the workforce for the most part. But what we're also seeing, you know, is that some of these cases, they may get the virus, you know, outside of the home, but then, you know, when they go into the home, they pass it along to their household contacts. And that's what we've seen over and over again the past few months. So we've been doing some messaging, and I understand we have multi-generational homes. A lot of people live together for whatever reasons. I mean, I'm Hispanic, and I hope one day my kids, when I grow older, they take me in, you know, because my family's really tight. And that's what we see. I mean, I see my father and my mother-in-law live with me because that's how we are. Not everyone, but that's at least how we are. But again, you know, just a lot of factors go into this and how, you know, the virus is spreading in the community. But anyways, going back to my point, the virus is affecting everyone. Now, this next slide, deaths. And this is why we constantly say, you know, if I protect myself, I protect those that are around me. And the comment that I hear a lot is, well, I'm healthy, I'm young, and nothing's gonna happen because, you know, deaths don't show that. But guess what? If I don't protect myself, and if I go home and I pass it over to my mother-in-law, the consequences for her, because she's higher risk, could be very severe and could lead to death. So again, I protect myself, I protect everyone that's around me. It's really important. So like you could see, majority of the deaths have been reported in individuals 50 and older. Something interesting though, in the most recent months, we've seen more deaths in the younger 30 to 39 and 40 to 49. Hospital census. I thought this screenshot would be helpful. If you notice, this is our May, June, July period, and that's hospitalizations, COVID-19 positive, and you'll see the big, increases in our activity May, June, July. But look at this. If you look over to the end, the October, November kind of time frame, that's where we are when we started in May. So we need to be very vigilant. The hospitals have done an awesome job preparing themselves because we knew that the potential for a second surge could occur. And, it was going to be, other respiratory illnesses were going to be added on top of it. So again, that's the trend that we've seen at the hospitals. We need to be very diligent, and we as community members need to really do our part to avoid, what happened in May, June, July. So moving on, just really quick, California Blueprint for a Safer Economy. We rolled over into this new system, and it's color-coded. We have the purple, red, orange, and yellow. Imperial County has always been in the purple because of our cases. And this is the state information. That's, this week's numbers. As you can see, we have the rates in, the 20s, and the testing positivity rate at 12%, that's the state data. And then 12.4% health equity positivity rate. Now, that one, that's a little difficult to grasp onto. I even have difficulties myself, but this is how I think about it. So we have a city, and if we divide it into two, south and north end, and if for some reason the south end is testing at 30%, but then the north end is testing at 2%, we need to figure out why that is happening. Is it lack of resources? Is it lack of information? What's going on with the south end that they have a 30% testing positivity rate, but the north end only has a 2, 3, 4, 5%. Something is going on. So the public health department then starts working, and trying to figure out what's going on. And if it's lack of resources, then, we secure those resources and do, some interventions there. So again, we stand in the purple tier. Our goal is to work towards red. So, yep. Here again, we have our trend lines. We're increasing. The one I didn't show before is the deaths trend line. I'm glad to see that currently it's not the increase, that we were seeing back in July and August. We had our majority of deaths back then. Next steps. Well, we need to continue with all the work, all the response efforts, everything that you saw in my list before. And then key. This is really, really key. We need to work with our community to get this under control, because there's this saying, it takes two to tango, right? So look at it this way. The one party, the hospitals, first responders, the public health department, they're doing everything they can to get ready, for that tango. But then the community is the other part. And the community needs to take advantage of those resources, the prevention measures. But if that doesn't happen, then the tango is going to become very difficult. That dance is going to become very difficult, and it's not going to go as smooth as we want it to. And so here, I think key is, because there's still no vaccine, hopefully soon, prevention right here, right now is the key. So if the community does the masking, the distancing, the washing of hands, the proper isolation, to prevent further spread, that's when, the community sharpening their tango skills, and then we are all able to sort of kind of do that dance, a little more smooth. Again, it's not going to be perfect, but I think coming together is going to be the key. a website that I think many of you will find really, really helpful to understand what is currently open in our community. It's the covid19.ca.gov website. You type in the county, Imperial, and then you can enter the activity, or you can just go get the latest risk levels, and it'll pop up a whole list, of sectors and activities that are open and at what capacity. Is it closed? Is it open, indoors only, outdoors only, etc.? So really good website to visit if you have an opportunity. And that's it. Open forum. Open forum. Comments, questions, suggestions.
Thank you so much for that information. This is Rosanna with the U.S. Department of Labor, and we're a coalition member with the Farm Workers Coalition, and we've been doing work with them and outreach. And so my question is, in San Diego County, we find that 35% of the cases are transmitted at work. So are you finding a similar trend in Imperial County? And with that being said, we know that the busiest time for agriculture is starting this month. It's already, and then December. And perhaps, what are some plans in place to address those concerns? And also, that's a one-part question. And then two, I also wanted to see if you can talk about the housing for agriculture workers. I think that's a great program that I just started to see information about. And I've been notifying our staff if they run into any farm workers while they're out doing investigations.
Yes, so trends, and we issued a report early on. Well, not early on. I take that back. It's not early on. 3 weeks ago, 4 weeks ago, and I know the community was asking for this information, but sometimes we're so limited with staff that we can't put those reports together, as fast as we wish we could. But we finally, gave a snapshot. It was a snapshot in time, March through July, and trends that we were seeing, and we included occupations. Let me just tell you, that's not necessarily where they got the virus, but that's what the individual self-reported, as their occupation. But through our case investigation, and I'll type both right now, we've seen the trends that were reported in, that report, and it's accessible at the Public Health Department's website. We are seeing a lot of transmission within the same households, like I said, because of gatherings. That was quite, it's been since the beginning. Gatherings, reunions, not using the proper prevention, gear, or practicing distancing. We have seen outbreaks. And continue to see outbreaks. And let me tell you, just a little side note, starting January 1st, we will be reporting or making it public, where these outbreaks are happening. So it's in the works. Just a little side note, but we are seeing that. Did we see, cases within the agricultural community? Definitely. Within retail, within, manufacturing. But let me tell you, within, retired, stay at home, students. So it's been a mix. It's been a complete mix of where, cases are linked to. As far as percentages, I don't have exact percentages for you. I wasn't prepared to give exact percentages, but I'm hoping that gives you an idea. Current trends right now. What we're seeing is transmission or cases being linked to, again, reunions, gatherings. We do see spikes after holidays. That's been a trend. Travel to, from, other areas, including Mexicali. But it's not just Mexicali. and other areas, Yuma, San Diego, etc., to either seek essential services or because that's where they live. So again, many factors that add to our local situation. Now, Housing for the Harvest, beautiful program, wonderful program. And public health is not leading that effort. However, public health has been, in contact with, the ag commissioner. We've been in calls with certain, partners in our community. And I know a couple of local agencies were going to work together to make sure that those resources were there, for the agricultural workers. I can't speak in detail about it. I know there's a flyer, but maybe if there's interest, from the community to learn more, maybe I can have someone who is leading that effort as a guest speaker, at the next community forum. Now, as far as testing, we are working with the California Department of Agriculture, with our Farm Bureau, with our local counterparts, to look at, explore the opportunities to bring testing to the agricultural community. And then masking. I know a couple of our community organizations, and there was a launch maybe a month and a half ago, and it was Assemblyman Garcia's office, Comité Cívico del Valle. I know Daniela, who's in the call, was there. There was a masking campaign that was launched and at the border. So a lot of efforts happening that help support the overall COVID-19 response. So I hope I answered your questions, Rosanna.
Thank you. Yes.
Any other questions? And let me take a look at the chat box here.
Yeah, you do have something in the chat box there.
Okay. It says, what will I win? What do I win? I'm sorry, I'm late to that comment.
Hi, Jeanette.
Hi.
This is Diana Garcia. I work with the Employment Development Department, but I'm also an outreach worker for the migrant and seasonal farm workers. And I get to go out to the fields, and so I provide information to the farm workers. I've been seeing them for the last month or so. They're out there working. So I was listening to your response right now to Rosanna. I did come across an employer yesterday asking me if there was any place where they can have like the testing go to their work site. So there isn't any right now?
No, there is not. Through the health department, through state resources, there is not. However, that is something that is being worked on, and that resource, we're in the final stages, and it's looking very promising. And we hope to make an announcement of the final response this coming week. So it could be very, very soon. And I know, like I said, some of our local partners, we've been in conversations with them, for the last 2 to 3 weeks. The state has also, we've been talking to the state quite a bit, and trying to, again, make that resource available to our community. So it's coming.
Okay, so will you be sending out like notification of when it does come up, or how will we know?
Oh no, for sure. We'll send those notifications out, and we will be working on information for the community. But during our Board of Supervisors meetings on Tuesdays, which can be viewed, we also make the announcements there. So we try to announce through different outlets to make sure that the information makes it out there. There's 2 questions on the chat. It says, for schools, bars.
Thank you.
Yeah, you're welcome. For schools, bars, businesses that are supposed to be closed, who are defying the orders, what can be done in this situation? Call your law enforcement. Call your local law enforcement. So here's what happens. the public health department, everybody has a role, right? And so the public health department, our health officer, you know, provides the clinical guidance. He provides, you know, the orders, working in alignment with the state. And some of you may have seen those posted on our website. You know, a new health officer order is issued, and then we follow the order. The enforcement lies on local law enforcement. So if anyone, and that question was asked yesterday during a press conference, if anyone is having an issue, you need to call your local law enforcement, and local law enforcement should be responding. We have another question here. What is the health department doing about the gyms that are opened indoor, even though Imperial County is still at the purple tier? We continue to work very closely with many in our community. Again, it hasn't been a simple situation, and we have been in communication with, you know, our state leadership, with our local leadership, with our businesses, and it's a work in process. That's all I can tell you at this point in time. But then it goes back to, we are a community and we live in this community, and whether I'm a business owner, whether I'm a resident, you know, we need to look at our situation, what's going on, what the current orders are, and you know, we need to follow them, because it's a trickle effect. All of a sudden we have many not following. Guess what? It's going to take us longer to get out of the situation. So we need to do what's right. Does everybody do what's right? Well, I'm not even going to answer that, but all I can tell you is the public health department is doing the best it can and working with the partners we need to work with to address many of the situations that we're encountering in Imperial County. Yes, and I know of a school that has been told to close. We are choosing to stay open. Let me talk to you a little bit about schools and what's happening. So in the purple tier, two things can happen with schools. There's cohort guidance, and the state issued cohort guidance, and schools that have a need to reopen their school because of specialized services, English learners, you know, high risk, etc. And you know, school officials know best, you know, when, you know, they need to provide an in-person service, you know, to a child that needs it. Of course, always taking the needed prevention, you know, measures, and making sure that not only the child is safe, but the teacher and everyone else who's on that school campus, for whatever reason, are safe. So that's one. That's why you may see some children at school. Is it, you know, a full wide school reopening? It should not be, because there's another process, and that's the waiver application process. And you know, the cohort guidance cannot be replaced with the waiver application, or it cannot be, the cohort guidance cannot replace the general school reopening guidance. So waiver process, if a school, transitional kinder through 6th grade, is interested in reopening for in-class instruction, that can also happen. And if you're interested, I'm not going to go over all the details, and knowing what goes into that application, there's a bucket in our website that's for schools and childcare. You know, you'll see the cover letter that was sent to school officials, public, private, and the application itself and the requirements. So there's those two possibilities, and that's why you may see some activity in some of the schools, but it's not full wide reopening for all the schools, and not the older children. So the middle schools and high schools. Okay. Any other question from the group? We have a little less than 15 minutes.
Jeanette, I saw a
Janet,
raised hand from Mark Edney. He may have a question.
Oh, I'm not seeing the little hands. Yes, thank you, Miss Father Edney.
yeah, thank you, Janet, for all this information. I had, well, two questions and a comment or an observation. It's anecdotal, but I'm going back to what the question about where are the cases trending. And the thing is anecdotally, I mean, I've heard this from a lot of, from construction sites on the farms and all that, that the businesses are following protocols for when the employees are working, but at lunchtime or break time, it all falls apart. That the employees sit together, eat together, and don't have masks, and that's it. And so I'm just wondering if that may be a real issue. I noticed, for example, recently Costco opened up a kind of space outside for its employees to have lunch or take their breaks. So I'm wondering if that's a really important issue. And the two questions I have that maybe you could address are, one, could you give a brief summary of how the information gets to you for the dashboard? I have noticed myself and others in the community have commented that it can be very erratic, the reporting. And I mean, you know, you hear people saying, well, in one day our cases jumped 200 or something. But I'm assuming that a lot, it has to do with reporting, okay? And when you get the information. But the final thing I wanted to ask you if you could address is, and I think this is extremely important, and I have not heard enough on it, is if you have been exposed to someone who's tested positive, how soon should you go and get tested? Because I have heard that many people have gone immediately to get tested and have come back negative, but then 4 days later or something have come back positive. So my doctor has said, you know, you have to wait a couple of days, see if you develop any symptoms, but certainly wait a couple of days. But I don't think that's generally known in the community.
Right. And those are all excellent questions and points you just made. So let me start with the first one. I wrote them down so I wouldn't forget. So the cases, the businesses, the employees, remember I said it takes two to tango. So if you take that same concept, you have the employer and the employee. And so we have been working very closely with many employers in Imperial County, and we actually partnered up with the Imperial Valley Business Development Economic Corporation. And so environmental health falls within public health. So we also have staff, you know, that work very closely with them. And so what has happened is we've gone out and we've done at least over 60 visits to these employers. And you're absolutely right. What we've noticed, not just because of the visit, but because of other outbreak investigations that we've done, the employer is doing what they need to do or going beyond, you know, what they need to do to keep their employees, you know, safe, their customers safe. But the observation you made, you know, the breaks, the lunchtime, but not only that, carpooling. The carpooling, what happens after they step out of the workplace, you know, is really important. And we've shared some of that messages, you know, some of those messages before, you know, through radio and through some other, you know, venues. Maybe we should do more in writing, you know, in print. But we saw that, you know, people very close, you know, people taking off their cover. And of course, they need to take it out to eat. But remember, the closer you are, the higher the risk, you know, you run when you're carpooling, you know, very confined space. And if, you know, you have 2, 3, 4, 5, 6 people, or if it's a big van or a big bus, again, the risk increases. So we have seen over and over again that, you know, when we do our investigations, the actual linkages are, you know, outside of the workplace. Not every time, but, you know, many times. So yes, you're absolutely right. And that is in some instances what's happening. So again, took a note. We maybe need to do a lot more in that sense. Also, the dashboard. Yes, really good points. And so I'll give you an example. I'll first give you, the example when it comes to deaths, and then I'll talk about lab reporting, which I don't know if it was you, Father Edney, you had suggested a little, disclaimer there about where we're getting labs. It's on the dashboard, it's there. But so deaths, for example, there may be days where we report 10 deaths. It has been the case in the past. But what happens is we don't always get the information, for all deaths that have occurred in a timely fashion. And it's nobody's fault. It's just, there's investigations that need to take place. Some of these deaths occur, outside, of the county. There's delays, there's different layers. We need to make sure that it's actually tied to COVID. And so by the time we get the information, a person might have, died 2 months ago. Or, yes, it just happened last week. But there are trend lines, if you notice in our dashboard, and we put that, information on the date it happens. If you just take a look at the main page, yes, you'll see, oh my goodness, 10 in a single day, but that's not what's happening. The other point about lab reporting, and it's been an issue not just for Imperial County, it's been an issue throughout California. So there's a couple of ways where results are reported, and it's through the state's electronic system called CallReady. So CallReady, laboratories are supposed to be connected electronically, to CallReady. Not everybody is. And that was the case in Imperial County. There was a time that, some of our local providers were not connected, not because they didn't want to, but because, it's system to system and connections and all that back end that needs to happen. And, they couldn't communicate. We've been working at it and we were successful with some, not as successful with others, but we're still working at it. So those results were coming in via fax, via email. And so that's why many times our dashboard displayed a lot more numbers than the state. So we had to manually, enter information, and we had to do that a couple of, times. And when you have such an emergency, there's only so much data entry you can do because you actually need to take care of the actual current needs of the community. So, and let me tell you, it's just not local agencies, it was other laboratories, outside of Imperial County that were also having the connection issues. So yes, definitely something that not many know or understand that has been happening in our community. And then exposed, those who were exposed and later tested positive, right, because there's a period, the infectious period, and it takes a couple of days to maybe come out positive. So that's why the quarantining period, the 14-day, and checking for symptoms, that's why it's so important that you follow when you are exposed, because yeah, you're right, Father Edney, it's not always immediate, or maybe you already had it even by, before being exposed by that individual that you got notified. Because let's remember, it's community-wide, it's spread, all over, and you can pretty much grab onto that virus. Let's hope not, but you can grab onto it, not even knowing where. So a lot, in that end, but yes. Did I answer all your questions, Father?
That's great. What I would just suggest to you, perhaps, Janet, is maybe you should do a very short interview on radio and even television, and maybe in print, just to answer those questions really briefly, so that people have it quickly in their minds. I think particularly the thing about when you should go get tested. Because
Perfect.
they're, you know, come back with a false positive, essentially, and then spread it a lot more because they think they're okay.
Yes, yes. And here's my pen. I'm taking notes, and I know my team is also taking notes because we truly value.
Thank you, Janet.
I honestly, you know, truly value the comments, you know, the comments, the feedback. Do know though, I'm gonna be very open. We don't always have the resources, the funding, the staffing, the funding, but we don't let that stop us. We start looking, you know, we start asking for help. We start joining forces. Let me tell you, we're joining forces with our Office of Education and their communications team. So both our teams are going to come up with some additional messaging, you know, targeting the schools, targeting, you know, the families, you know, some of the similar topics. But yes, coming together. So partnerships are really, really important here. And so yes, we're taking notes, and if we don't have it, we can't create it, we'll figure out a way to make it happen. But just be patient. There's another question on the chat. Do employers know about the federal and state paid leave for employers that need it for COVID-19? They should. They should. Human resources departments should be aware, and I know the county has posted information about that. Let's see, U.S. Department of Labor enforces the federal paid leave. Federal law is, yes, the FFCRA that expires on December 31st. Thank you for that. And there's a link for anybody interested. Rosanna placed the link there. So yes. Any other question? No other questions? I don't see it. Okay. Is there an updated list of businesses that should be open or closed? Remember that website? That there is. There is. I would need to check back to give you where in our website you can find it. I'm gonna share my screen again. Let me make sure I have the right one. This one's in English. And I'll share. Dun, dun, dun. Let's see. Where do I have it? I can't find it anymore. Right here. This one. Oops. This one. We embedded a link within our website because I know that's a common question. If you go into our website or you go directly into the state's COVID-19 website, if you type in Imperial County and you're interested in any single you know, business or sector or activity, type it in. Type it in and it'll pull up you know, whether or not that activity or that service or that business is allowed to open and to what degree, because it could be outdoor, indoor, or not at all open. And so that's what I truly like about this, the new website, because the state had another website. I really like this function because I too go there. Sometimes I don't always know, you know, what's open, but if we go there, it'll give you that information. And then on the one slide, and I'll put it on the notes, on the California Department of Public Health's website, and maybe I can, for the next one, I'll have it available. There's like a spreadsheet and it's color coded and it tells you, you know, by activity or by sector, you know, everything that's open at that time, and it's available on the state's website. You download it, it's like an Excel sheet, but it's technically this one, you know, the state's website, but that other one, it just has everything in a single document. I don't see any other questions on the chat box. It's already 12. I want to thank every one of you for for being here. If there's any topic of interest, that you want to hear about, let us know. I mean, I'm planning to talk about vaccine, the COVID-19 vaccine. I think by, in 2 weeks, we should have a lot more concrete information. So I'm planning on sharing some information about that. I'm hoping to share, the good news about the additional access to testing. And then if, you want to find out more about any particular topic, let us know. Harvest, housing for the harvest is also on my list. So let us know. Let us know. We'll get you the information that you need. No other question? All right. Thank you, everyone. Thank you for joining us, and I'll hopefully see you in 2 weeks. Bye.
Thank you.
Thank you.
Bye, Jeanette.
Bye. Take care.
You.